So what is this ketogenic diet anyway? Can a ketogenic diet help me with weight loss or my metabolic health? Can it help prevent chronic disease? Is it a fad diet? What are ketones? Welcome to part 2 of my Keto 101 series. Thanks for stopping by. These are some of the questions I hope to answer. So in part 1, we investigated the USDA food pyramid. Well, now I'd like to show you a ketogenic or low-carb food pyramid. You're obviously going to see some big differences. So the foundation of the USDA pyramid was grains. Look at the foundation for a ketogenic pyramid. Healthy fats. That is the foundation of a ketogenic lifestyle. The next tier of the pyramid are all of the healthy sourced proteins. These include animal proteins and plant proteins. And of course, many ask, well, don't you eat vegetables on a ketogenic diet? Well, of course you do. The third tier of this pyramid shows a variety of non-starchy vegetables. And remember that some of the things we call vegetables aren't really vegetables. For example, peas and corn. They are starches. They are not necessarily handled in our body like the low glycemic or non-starchy vegetables. You can see that you can have some dairy and nuts, and the fruits that you're allowed on a ketogenic diet are the berries. They have good fiber and are very low glycemic. That means they don't affect your blood sugar as much as other fruit. So you can tell by looking at this pyramid, it's quite different than the one that we've been using to create food policies and feed ourselves since 1977. This is what I like to call a carbohydrate continuum. Depending upon what health conditions you have or symptoms you're trying to treat, you can fall anywhere on this continuum of how much carbohydrate you eat. You can be a vegetarian and eat a ketogenic diet. You sure can. Some people are very healthy and have no medical conditions, and therefore they can eat anything from the standard American diet on to the vegan diet on this pyramid with lots of carbohydrates and do just fine. But it's when your body is telling you that something's wrong that you may need to look at controlling your carbohydrate intake. Mediterranean diets are quite widely used and quite healthy. 50% of a Mediterranean diet are carbohydrates, but it's also very high in olive oil, which is a healthy fat. It's very high in fish. When you start on the low carb continuum is when your carbs are dropped down to less than 10% of your daily intake. This is for conditions like diabetes, PCOS, inflammatory bowel disease, neurological conditions. So if there are specific conditions you're trying to treat, you may have to lower your carbohydrate intake. There are those with neurological conditions that benefit from lowering their carbohydrates down to less than 5% per day or less than 7%. The classical epilepsy diet was very, very low, if no carbohydrates. The goal was to raise the blood ketones. So you can see that therapeutic carbohydrate reduction is on a continuum according to what health problems you're working on or symptoms you're trying to mitigate. So did you know that cholesterol makes up a large part of your brain? The brain utilizes 25% of the body's total cholesterol content. We've all been taught to go low cholesterol over the last 30 years. Well, did you know that cholesterol is the fireman that helps put out inflammation in our body? It's neuroprotective. And remember that it's not the fat you eat that makes you fat. It's the carbohydrates and sugars. Through the elevation of blood insulin levels, insulin is the fat storage hormone. So, you see a lot on the internet about this keto diet thing. How do you know if it really is keto? Well, I can tell you that if it comes in a box or a bag with a barcode, as Dr. Ben Bickman would say, the chances are it's not ketogenic at all. The ketogenic diet is based upon whole foods in their most natural forms. If you shop the perimeter of the grocery store, you will find whole foods, the produce section, the meat section, the dairy section, the eggs, and then out the door you go. A classical ketogenic diet is made up of meat, fish, poultry, eggs, and seafood, full-fat dairy like Greek yogurt or cream cheese, mostly green vegetables or the low glycemic ones, the greens like mustard greens, kale, spinach, those are very good, the non-starchy vegetables, the healthy fats like coconut oil, avocado oil, olive oil, grass-fed butter, beef, tallow, and lard, and lots of good water intake on this diet. So there are essential nutrients for the body. Essential means the body can't make them. You have to eat them to live. The first one is fatty acids or fats. It's mandatory to take in fats to meet your minimum daily requirements for life. And when we all went low fat 30 years ago, we simultaneously saw a massive increase in chronic disease. The second essential nutrient are proteins, amino acids. They're mandatory to maintain life. These are most easily used from animal-based protein sources. But with some work, if you're a vegetarian, you can meet your daily protein needs with a vegetarian diet, as long as you're willing to eat dairy and eggs. So, what is the essential need of the body for carbohydrates? There are 0 essential carbohydrates needed for life. Let me say that again. Your body has 0 need for carbohydrates. I think that really brings to light the fact that ketogenic diets are not only healthy, but they're adequate nutritionally. What are some of the benefits you might see on a ketogenic diet? Well, the ketogenic diet helps you create ketones in your bloodstream. As I've shared on many of my videos on my YouTube channel, ketones are neuroprotective. The brain actually prefers them for fuel. They're anti-inflammatory and they promote cell growth in the brain. The ketones can function at the cellular level in the brain to strengthen the mitochondria, the energy-producing cells. They can reduce inflammation in the liver, and they can help reduce the strain on your pancreas to control your blood sugar. Ketones increase with the use of a ketogenic diet, fasting, and the addition of healthy fats like coconut or MCT oil. So what is fasting really? The benefits of fasting helps to clean up those dead and damaged cells. This is called autophagy. This is important. You don't want a lot of garbage cluttering up your cells. The benefits of a ketogenic diet enhance the effects of anti-inflammatory and neuroprotection through the elevation of ketones. The ketogenic diet was used in oncology for cancer treatment for many years until the big boom in cancer medications. Elevating blood ketones was used in combination with chemotherapy to enhance the effect of the chemotherapy because cancer cells cannot live in the presence of ketones. They're toxic for cancer cells. Elevation of ketones helps to balance your hormone levels. And yeah, it can fix your insulin resistance. Intermittent fasting methods, there are several I want to point out. The first method is just lengthen the time between meals. Try moving to breakfast at 6 or 7 a.m., lunch at maybe 1 p.m., dinner at 7 p.m. Lengthen that fasting time between meals. If you're new to fasting, this may be a great way to start. Another method is to decrease to 2 meals a day with a 16-hour overnight fast. A way you could do that was maybe have your breakfast or break the fast at between 11 and 12, and then dinner maybe between 5 and 6, and nothing else, no snacks. Another method is an occasional 24-hour fast. Maybe breakfast at 8 a.m. and your next meal is tomorrow at 8 a.m. This is an example of what I use with my patients for a prolonged fast. This is a 72-hour detox fast. This is for people with significant GI issues. I have found this works very effectively for them. So for 72 hours, you drink all the water you can, herbal tea, and bone broth. You can drink as much as you want. So what are the organizations that are now seeing that the ketogenic diet is safe and effective, and they're beginning to recommend this approach? Well, the American Diabetes Association, hooray! They do now recognize that this is the fastest way to normalize your blood sugar and reduce your need for medication. NASA has been conducting research in the use of the ketogenic diet that has protective effects for astronauts and Navy SEALs, protecting them from oxygen toxicity seizures in high oxygen environments. The Veterans Administration is now using the ketogenic diet to work with their recruits who do not qualify for the military due to metabolic health conditions or obesity. Even the American College of Cardiologists and the American College of Physicians are now recognizing that the ketogenic diet is safe and effective. Of course, the Society of Metabolic Health Practitioners that I am certified by, and the Epilepsy Society has known for 100 years that the ketogenic diet is effective for patients with epilepsy. And if you don't believe them, well, would you believe God? Did you know that babies are born in a state of nutritional ketosis, and they maintain this level of ketosis as long as they are breastfed? Now, what are babies doing? Babies are growing, their brains are developing, they're developing organ systems, and we know that ketones are very protective of these processes. Did you know that breast milk is the perfect ketogenic food? It has 75% fats, 20% proteins, and very little carbohydrate. Isn't it interesting? The babies who need to have peak nutrition to grow their brains and organ systems and skeletal structures are getting ketogenic food as long as they're breastfed. This state of nutritional ketosis is protective of the brain as it's developing in infants. Ancient wisdom would say, when diet is wrong, medicine is of no use. When diet is right, medicine is of no need. And of course, Hippocrates said, let food be thy medicine and medicine be thy food. So what are my final tips and takeaways? You've heard these before. Reduce your daily carbohydrate and sugar intake to reduce your insulin resistance and inflammation. Adopt a ketogenic diet. On that carbohydrate continuum, where do you need to take your carbohydrates to influence your blood sugar and metabolic health? Obtain a meter so that you can start tracking your daily glucose and ketones. Add those healthy fats. Take out all the processed food and sugary drinks and juices and grains. Begin a daily exercise regimen with aerobics and resistance training. Try adding MCT or coconut oil each day to elevate your ketones, along with trying one of the intermittent fasting regimens that I reviewed. Thank you for viewing part 2 of Keto 101. I hope you're learning a lot from this series. I will see you in part 3